Good morning and welcome to Tuesday Tooth Talk. I'm Dr. Kuiper and today we're going to talk a little bit about broken teeth and how we can help you to get those fixed. So broken teeth happen for a number of reasons. The most common ones we see are teeth that have had large fillings in the past, and then anytime you put a filling in the tooth, the filling is never quite as strong as the tooth and it doesn't truly strengthen the tooth. So the tooth becomes weaker and you still chew on it, which the average person chews about 5 to 10,000 times per year on each tooth. And each time you bite, you're putting about 700 pounds of pressure on the tooth. So that's a lot of wear and tear on a very small object. So eventually, part of the tooth pops off and then you come in to see us. And at that point, hopefully, it's a very simple fix, such as something like a filling, or for teeth that have had a lot of work in the past, a crown. Those things are typically 1, maybe 2 appointments, very simple, fairly minimal investment to have something that's going to last a long time to come. Now, if the tooth breaks in a way that the nerve or the pulp inside the tooth is exposed, then we're talking about a couple different options, such as something like a root canal, or worst case scenario, the tooth breaks in a way where it splits almost like a log in a log splitter, and then at that point there's not a whole lot we can do to fix it. Unfortunately, then we're talking about taking the tooth out and discussing replacement options, which if you've watched some of our previous Tooth Talk videos, there's a couple different options for that, which are all good options. It just depends on what you're looking for. But at the end of the day, if you notice a tooth that is chipped, broken, fractured, anything like that, the main point I want you to get from this whole video is that no matter how big or small the area, we want you to feel comfortable coming in and talking to us about it, because even those small areas that may not seem like a big deal can be areas that can trap food and be highly prone to decay. So if you think about it, when you get decay in an area that already has a chip or a broken area, those have a big jump start towards the inside of the tooth. And once they get going fast. So what is once a minor problem becomes a very big problem in a short amount of time. And along with that, takes more time to fix and more expense on your part. So please let us help you out when it's something minor and easy to take care of. Come in and just let us know about it, and we'll help you out in the best way we can. So enjoy the rest of the day, and we'll talk to you next week.